you treat a lot of patients, and some of the things that you encounter, I'm sure, with patients are decisions that they make that create the circumstance you're trying to help them with. In other words, a lot of it, and we don't really talk about this in healthcare, but a lot of the health problems and challenges that we deal with as human beings are self-created. And we're looking for some kind of solution or some simple, easy fix.
Right. Lifestyle choices, right?
Yeah. So talk about that, because and then we're getting into Cytonics and A2M and stuff a little bit. But you are obviously inspired incredibly by what you can create in life and what you can experience in life and what would happen if you took control or charge over a situation or your own health or your own outcomes or performance. And that seems completely consistent with Cytonics and A2M. Like, you can't just sit back and say, I guess it'll just work out, or this shit's just happening to me. Right. Your company and your latest creation, I should say, because you're a serial entrepreneur, not just one done. Tell us about the inspiration for Cytonics and A2M. And people that are in the regen space know about it, but they might not know about you. I'd like them to know about, shed some light on that for us.
Sure. So it's interesting that you brought up the lifestyle choice about treating patients, because like every other human on this planet, I am a victim of my lifestyle choices. And I made lots of stupid decisions. And one of them, which I actually still want to do, but my wife won't let me, is ride a motorcycle. And so I crashed my motorcycle, and that's what, lifestyle choice. It's like eating too much and not exercising, or drinking too much, or there's a minute we could list. But for me, it was riding motorcycles, and I had a really bad crash and ended up with 4 surgeries, and I actually couldn't operate for about 6 years.
Oh, wow.
Yeah.
So you messed up your hand.
Messed up my hands, messed up my neck, wore off my right kneecap. That's a whole other story. But I was out for a while, and I had a pivot. I went through a severe depression, because when you take somebody like me with a type A personality and now you can't do stuff, it was a very difficult transition for me.
6 years.
Yeah. Sold my house on the water, and was a successful spine surgeon. My wife's pregnant with Juliet, with my little one, and this horrific thing happens. And then, we sold the house and moved to I think I'm the only person I've ever met that in the early part of their life, before they retired, downsized. I sold my home on the water. I was in a panic mode that I wasn't able to support my family.
Right.
And moved up to Jupiter, got a house in the middle of a nice little community that was less than half the price of, because I wasn't making any, I'm not an active spine surgeon anymore.
Right.
So that was a very difficult time for me. Prior to that, I was always interested in doing research and trying to understand and why patients. For me, as a spine surgeon now, I finished my training, and I was always interested in trying to improve surgical techniques and try to improve technology. My background was in biochemistry, and there's a big tendency in orthopedics to focus on devices.
Right.
Or just fixing stuff after it's broken, replacing joints after they're destroyed. And so I took things from another perspective, not knowing that massive hill that I would need to climb.
But you were using all those devices, T-lifts, effortless cages, the whole thing, because you're orthospine guy, so you're using all that stuff.
Yep.
But you're intrigued by something different.
Right. Why patients, I could operate on a dozen people and they do great and their pain goes away and I don't hear from them again until maybe they have a new problem. And then some patients, quite a big amount, you would see after a knee arthroscopy, for example, or after a spine surgery that went perfectly fine, they had some back pain or knee pain that just went on and on and on. And then when they came back in and were restudied, their disc space was collapsed, almost like they had this horrific infection that had occurred, even though they never had an infection. Same thing with the knee joint, it would be collapsed. And so I hypothesized that there's something going on where like the light is broken, like in the on position, for this healing mechanism that goes on. So it's a very complicated physiology that happens when you have an injury. There's an acute response from the trauma, and we call it an inflammatory response because it has to do with these inflammatory molecules that essentially clean up the mess.
Cytokines.
Yes, they clean up the mess, and then they help repair it.
Right.
And then they're supposed to turn off
Right.
and leave the room.
Right.
But in a lot of patients, it doesn't. It gets broken in this on position. And so the cleaning, these enzymes, they're called proteases, I call it battery acid, stay in the joint, stay in the area, and they wear things out. And that's like a rapid aging process.
Post-trauma.
Post an event. And then, and that's in most people, right? Because people that typically come to see me or after trauma. However, there's a decent group of patients or people that have just a genetic predisposition to get early arthritis. We've all seen and heard about these people who need knee replacements or hip replacements on both sides.
Yep.
They never had any specific history of trauma. And then we have these other very unfortunate situations where patients develop autoimmune diseases where their body attacks them.
Yep.
And they're very similar proteins down the line. It's a different stream early on, but then down the line, they're the same proteases and cytokines that are destroying the joints and wreaking havoc not only on your musculoskeletal tissues, but on other tissues as well. And so I was always interested in that, and I had some free time on my hands because I wasn't operating.
This whole deep dive into this problem and problem solving happens after you're taken offline for about 6 years where you can't function and you can't operate and work like you used to.
Correct.
And that's when you're kind of sucked in, if you will, into the vortex of you got to think about creative problem solving. This is where you can spend your time and energy.
That's exactly correct. Exactly correct. So I got some approvals from these IRBs, they're called institutional review boards, to get their ethic committees to allow me to obtain samples. And there are these tests. We've all heard about the rapid COVID tests. We're familiar with these certain type of tests now. And they're, say again?
PCR.
Yeah, exactly. Well, those are even the more sophisticated ones, the polymerase chain reactions. But the original ones were ELISA tests, these enzyme-linked immunosorbent assay tests. And basically, there was a sample that you would give, and then we can test for one specific thing, like insulin. We could test for, gamma interferon or a certain protein. And a company. So I'm interested. I'm doing research even before I had the accident, but now I'm not operating anymore. So I have all this free time. I'm trying to get my mind, because it's putting through this depression. So I started focusing more on the biochemistry to try to see if I could figure this out, why these people have this issue. And there was a company called Linkoplast that was in Baton Rouge that had developed this assay where you could actually take a sample and do a couple of different tests at once. Saves money, it saves time. And plus, you wouldn't have to take a massive amount of blood. You can do it with the same sample. It may sound familiar to some of the viewers. This is the Elizabeth Holmes story.
That's right. Yeah, fairness.
Which we'll get to, because I was there.
No shit. I didn't know that.
I can give you the inside of what was going on. So that's another story.
Wow.
Because I was at Stanford. So I start doing these enzyme-linked immunosorbent acids. They're called multiplexes, because usually you want, and now they have several. And so I'm sending samples to Baton Rouge, and I'm writing checks and looking at these things, I would get samples from patients' backs, from surgeries, patients' knees, from an arthroscopy. I got an IRB, and I would go around to different doctors, and they all kind of felt bad for me. Oh, Scuderi, I heard about you. Sorry about your injuries. Hey, dude, do you mind? I'll give you these little tubes on your surgeries today. Just put the number. No, I don't need any patients' names or anything. And I just need a story about what you're doing, what the surgery is, ACL reconstruction or medial meniscus tear, discectomy, the pain guys that were doing the epidurals. So we started looking at all these assays, trying to find a protein. So I'm going to cut to the chase. Basically, I discovered a protein associated with pain in musculoskeletal pathology. And it's a complex of these two other proteins. So most of our bodies are made of, any idea what's most of us made of? Water. Very good. So that's 70%. And then we have the skeleton, which is a lot of calcium, right? But everything else, the tissues, they're made of proteins, right? We have many, many thousands of proteins, and through our bloodstream by about 670 of these proteins. And they all have a very specific function. And the simple one that I can explain to you is insulin, right? Everybody knows what insulin does because so many people have diabetes, right?
Yep.
It's directly related to our blood sugar, right? Taking the sugar that's in your blood and putting it into the cells. And so, but every other protein has another specific function. And so I figured out that there's probably something going on related to these proteins and that's making these people develop these horrific problems after a trauma. And so it turns out it's a complex of these two fragments of proteins. This protein called fibronectin and another protein called aggrecan. But it's not, the aggrecan is actually a pretty large protein. It's actually this third globular domain. There's a whole bunch of different parts of this protein, and they make this complex together in certain circumstances, and that we published on this, that causes the pain cascade, this inflammatory cascade associated with pain.
Right.
So that's why you're having pain. It's one of the proteins associated with pain. So I discovered that using these multiplex assays, and while that was going on, I was publishing papers on the mechanisms and the methodology that I was using in the epidural space to retrieve samples. And I got a phone call from a guy at Stanford who was in the pain department that was working on some things in animals. And so we started collaborating together on this project, and just we identified the protein, marked the signature. There was a lot of different things that went on. And then somebody in the orthopedic department, this guy named Eugene Carrigy, who was another one of my mentors as an adult when I was already in my 40s. He is a decorated physician, soldier. His story is amazing. A couple of Purple Hearts, but a famous researcher, won multiple awards, Volvo awards in research, an amazing researcher. And so he heard that I had discovered this thing, and he was intrigued. And he said to one of the guys in the pain department, the next time Scuderi comes to help and work in the lab, I want to meet him. So I go there and I meet him, and he offers me a job. And I had just started I was playing violin a lot. My dexterity was coming back. So I literally had just started doing surgery again in Jupiter, where we had moved. But I had to do it under a proctor.
Yeah.
Because I was out for so long.
For a while.
And so he said, why don't you come and I'll get you a position here. You can work as a fellow. We'll do a 6 month. You can do it for a year if you want. I said, 6 months, probably plenty. And you could work with us and you could continue your research and we can work together. So, of course, I get home. The salary, of course, is way less because now I'm doing consulting work now and I'm making decent money. And I said to my wife, honey, this is what we make and this is what Stanford's offering me. And my wife is amazing. She's, I would not be where I am today without her. And so she says, what do you want to do? I says, Stanford University, I want to be a professor there. She goes, well, you're not going to be a professor. I said, well, yeah, but I will be. I want to go and impress these guys because they don't know who I am, a nobody. And they'll help me with this research. So she goes, okay, let's go. So we rent an apartment.
Oh, sure.
And
for 6 months?
And we move out there. And I get my house.
With your kids?
With my kids, yep. And so we go out there, rent a little place right across the way.
Wow.
And I start working, helping out Dr. Carrigy in surgeries, stuff like that. And 3 weeks in to the surgery, to the fellowship, he has another fellow that's working in another room, and they stagger them. A lot of busy orthopedic surgeons. Yeah. So there was an issue. So he goes, "I'll be right back." He goes, "Just get started on the case." It was an anterior surgical procedure, fusion on some guy, and so we had the access. We were about to get started, and he says, "I'll be back in about 10 minutes." And he went next door, and so now I'm by myself, and I was like, "Okay, this is it." I had to run to the tech. I said, "Give me the next it," and I just started working. Not fast, just at my regular rate, but I've done this 1,000 times more. And about 20 minutes later, he walks back in, and he expects to see me working. And I have a blue towel over the patient, and my hands are on the patient, and I'm just having a conversation with the nurse. And he comes in, he goes, is everything okay? Why aren't you working? I was like, I'm done, Dr. Carrigy. And he's like, you're done? He looks at the clock. He goes, I'll be right back. And he goes and he scrubs. He comes in, gets dressed, take the blue towel down, expose the thing, looks at everything. I had taken the final films, looks at the x-rays. See me at the end of the day. So we close up.
Did you think you were in trouble?
I wasn't sure. I was like, maybe I went a little too fast and he's going to reprimand me, tell me not to do that again.
Right.
Maybe he's going to say something else. I don't know. So I go and sit down, 6:30 at night. I sit down in his office and he says, why don't we just skip this fellowship thing? He goes, why don't you just come on and put you on as a assistant professor. So yeah, and I was like,
one case, the guy learns, you're ready to go.
Yeah, well, I had done case with him before, but just as an assistant. This is the first time now that I'm by myself, which of course I was a sponsor for 11 years.
Yeah.
Very busy. So, and he liked me. And so he took me under his wing and it was amazing. And I switched over and was there. And then we had that IP, the intellectual property, the IP related to and we were developing and commercializing this assay. And he had a lot of connections, Dr. Carrigy, because he's very famous. And there's a famous guy, Hansberg Weiss, W-E-I-S-S. He's a Swiss guy. And he owned a privately held company called Synthes Corporation, multi-billion-dollar company. He was the owner of it, that he built a Swiss company that many sponsors like myself use this technology, high-end, very complex implants. And he was buddies with Dr. Carrigy. And so whenever he was in town, whenever they would meet, where there was meetings. So on one encounter in 2010, he's like, what's going on at Stanford? What kind of new exciting things are going on with Peak Space? He goes, I got this new young guy. No, I wasn't there. I'm just paraphrasing what I'm assuming happening. Because I got this new guy. He just came on. He's got a fascinating story about his life. And he's joined me a couple months ago. And he discovered this protein associated with back and joint pain. And he goes, it's going to be something. The guy's got something. He goes, you should meet with him. And that's where I would consider making an investment. So
Weiss says this.
Yeah. No. Carrigy said this to Dr. Weiss.
So who's the one that wants to make the investment? Weiss, though.
That's right. Yeah, he's the
guy who's got the money.
Yeah, he's the rich guy. Billions. So I meet with the team, the global development guy, and the president of this and that, and I present the thing, and it's a diagnostic. So think about it. I'm going to tell you, if I lavage your knee, you have knee pain and an MRI scan, and it comes back negative, my recommendation, the test is negative, you don't need surgery. The pain that you have is not coming from that spot. That's what it is. It's a no-go thing. Industry doesn't want that.
No.
Doctors don't want that. I didn't think of that. I actually never thought, as an ethical person that was just looking at it never came to my mind. And so the global development guy goes, we don't want this. So he went back and goes, Mr. Weiss, we don't want anything to do with this. This is going to lower your sales. And he said, because I know a guy who was in the room, because he ended up being on my board, we'll get there, Jeff White. He said, Dr. Carrigy said it's big. I want to be involved in it. It's going to be huge. And so he invested, and they bought 19.9% of my company. And it was a $4 million investment.
It was the first raise. What?
Yes. Well, I had a couple of friends of mine gave me $150,000, four of my friends. And so it's 20%. Apparently there's some accounting things that you have to submit to the government if you own 20% of something for tax reasons. So they invested, they got 19.9% of the company. He gave us $4 million and a $4 million licensing fee for the assay that they were going to finalize the commercialization of and prosecute the patents because they were pending at the time. So it ended up being about an $11 million deal for 90% of the company. So they're commercializing and getting it ready to. I'm so fired up now. If you asked me a year ago, I would have told you, yeah, I should have just distributed the money to my original people. Everybody made money, and we shake hands and we parted ways. But I was like, I'm going to give a little pivot. You're familiar with rheumatoid arthritis?
Yep.
I used to operate like crazy on patients with cervical problems, from instability from a lot of women that had this horrific disease of rheumatoid arthritis that was crippling. Remember in the days, I don't think you're as old as I am, but you probably remember people with these horrible looking hands that they get deformed. We used to have to replace them. We called rubber knuckles with silicone implants. These surgeries for rheumatoid patients are gone. They don't exist anymore. The guy who figured out the protein, because every problem that we have is a single protein problem. Diabetes, insulin. Tay-Sachs disease, it's a mucopolysaccharide. People with thyroid disease, it's a thyroid problem. So, and I can go on and on and on. Well, cystic fibrosis, there's all these different proteins. So I lost my train of thought.
You were talking, you were going to connect with your company, you find this protein.
Yeah.
And
so,
yeah.
So I said to myself, I'm going to figure out what the protein is associated with this arthritic condition using the protein that I discovered. I'm just going to figure it out. So I'm going to let's take the money, and instead of distributing it, let's see if we can find, because of the rheumatoid arthritis guy, TNF alpha, he discovered tumor necrosis factor alpha was the main protein, it's a cytokine that's creating the RA. And they developed blockers to it. And now last year, it was a $30 billion a year drug, $30 billion. Now, rheumatoid arthritis is about 1/10 as common as osteoarthritis. So 30 billion, 300 billion. You follow me?
Yep.
It's a massive, osteoarthritis, cancer occurs in about 1 out of every 6 people. What do you think the ratio is for patients with arthritis?
A lot more frequent.
Everybody. Yeah. If you get old enough, everybody gets it. It's unfortunately a part of aging.
Yeah.
And so there's a big push now for anti-aging therapies.
Yeah.
This is exactly so we'll get there. Because this is a true anti-aging, guys like Jeff Bezos and Larry Ellison, all these guys now are really pushing because they're getting older and looking for growth hormone, there's metformin, there's a lot of different things that we've learned how to slow down the aging process, right? So I said, guys, we can do it. We're going to figure out arthritis. And and here's why. Because I was at the OARSI meeting, the osteoarthritis research meeting. It was a meeting in New Orleans, 2009. And it was after to me, it's the second biggest failure. The first one was this anakinra drug for IL-1, because someone else had discovered that IL-1 was a main inflammatory protein associated with osteoarthritis. So they developed blockers to it, and they literally spent about $400 million, and it failed. Didn't work. And then Pfizer developed a nerve growth factor for osteoarthritis, because nerve growth factor was another protein that was identified with arthritis. It failed. So all the researchers were like, that's it, we're done. Pharma is done. Don't believe me? Show me where they're doing studies trying to cure osteoarthritis. They gave up. They'll buy companies that are doing it, but they don't spend any more money doing research. These big pharma companies, I've talked to all of them, not all of them, many of them. They're not interested in developing drugs for arthritis. They'll buy a company that eventually has a cure, but they're not interested in doing the research because they fail all the time. So we decided, you know what, we're gonna do this. After that meeting, I'm gonna figure it out. So we played around in my lab. With the money that we got, we built a lab, and I ended up at the maximum we had 24 people working in the lab.
Lord. In
For Cytonics, yes. So I was going to move it. So that's another story. There's so many fascinating stories. It's going to be a Netflix documentary for sure, in probably after next year, because of what's going to happen. But I was going to move it to Stanford when he asked me to go there. But this was 2009. Do you remember what was going on in 2009?
Yeah, financial hell.
Exactly right.
Right.
It was hell, and
Right.
It's going to be for sure, because my story. Because I got arrested a bunch of times, and then I want to fucking blow open the farmer. So you're still probably recording.
Yes.
We submitted grants to the federal government because I was sure that I had a cure for osteoarthritis. And we got it's called a fundable score. They rate your scores, and then if you are in a certain range, you get funded. Unless you're a nobody. They only pick each other because they're all scored. We had amazing scores 2 times in a row, and I spent a lot of money writing the grant with grant writing assistance, the additional research that was necessary to put together the grants. They're hundreds of pages long. We didn't get funded either time. No money, because it's anti-dilutive. It would be a big deal for investors. No interest. It was infuriating. There's a bunch of other stories that I could tell as well. The disaster of trying to build a pharma company with no connections. One of the biggest mistakes in my life, I was getting, and Dell Computer, Michael Dell has a plane from Austin. His guys I operate on some high level people. All these people from the wineries in Napa, I was doing all these surgeries on these because they liked me because I was whatever. And so I'm doing these cases and they would offer, you got to come. We had this 501c3, we had this charity event. You used to come, you had a tux. But I didn't want to go. I'd rather hang out with a bunch of Brazilians.
Yeah.
With a bunch of thugs and train. That's what I do in my spare time.
Right.
And hang out with my wife. And so I didn't exploit any of these opportunities and that was a huge mistake. That's probably the biggest mistake I made in my life of not engaging with people with money that could have either the cure would already be out now. Right. That's how long it's taken us. Right. Because I don't have enough money. I'm not rich because I've been funding it myself though. It's been a nightmare. So
you're on.
I'm gonna fucking discover. So
I'm gonna discover the OA.
I'm gonna discover it. I'm gonna get it. So we get in the lab. I got there it is. 24 people. So I got 24 people. Now you know who are employed by me now? One.
What?
Because I fucked up again.
What?
I hired when I raised the money. I didn't tell you this part. When I raised the money,
gave it away to employees.
When I raised the money initially, I hired somebody that was a CEO.
Right.
These fucking CEOs, they don't give a shit about your company. All they want is for themselves. They give themselves, and I got two, and they got a big piece of the company because I didn't know how to structure it. They still have it. It's infuriating. And then they go out to dinners, and I go, "What's this? Oh, it's a more important dinner meeting. We're a biotech startup." What? Throwing money away. We spent all the fucking money. You don't even know. And so after I almost went bankrupt, I kicked everybody out. I run my business out of my house. The phone, will call up. They go, it's my, well, what up? Sometimes this is Mr. Thing for the CFO from Pfizer. Frank, Mr. D'Amelio, I'm sorry. This is my cell phone. That's my business line. We have nothing. I run it literally out of my house.
And I know how much time it takes because to get in to be your patient and get you to fix my back.
It's crazy. Yeah.
I had to know somebody who knew somebody. Yeah. That's the only way I got in.
It's crazy. So it was very tough because we had too many people, but we figured it out, and they just kept throwing money away. And you really, when you do stuff, you have to have a lean company, and it was just irresponsible of my predecessors the way the company was ran. If people look at the balance sheet now and what gets done now, like, damn, there's no way you guys discovered arthritis. You got no employees. It's just you and one other guy.
But it ignores one hard, cold fact of life. Yeah. And here it is. You want to learn to do the right thing? Do the fucking bit. Right. Then you learn.
Yeah. You fail and you
then you do it. Yeah. But most of us, we quit.
Yep.
We don't fight through. We don't get to the other side. So we don't learn another way from doing it the first way.
Exactly.
You did. Right. And you stayed with it.
Yep.
And you thought about running the wheels off the cliff.
Exactly.
On bankruptcy, and you're like, I guess I'm done.
Every other year, it's okay. We're closing up. Then all of a sudden, another 50 grand comes in, another 100 grand comes in. It's a joke.
How close are you to an OA cure?
No, I already have it.
Yeah. So
he had it for years.
Tell us about it. So now you're not in pursuit of it.
So
you found the protein.
So here's the thing. We discovered it in 2010, 11, and I knew it. But I knew it was going to take time. And so one morning, I'm rounding on a Sunday morning, and Tiger Woods is on the screen. And he had just gotten
the ankle.
Yeah. I told you the story.
Yep.
He got the PRP injection.
Yep.
And a light bulb went off in my head, and I go, oh my God, we can take it out of our blood because the protein comes from your liver, and then I'll call it a PRP, but I'll get it approved, and I'll throw it to myself, and I'll get some human data on it to see if I'm really right before I... And so that's where, it's a whole other story, but that's what I did. And of course, the PRP thing didn't work on him.
Nope.
And it didn't work on Kobe Bryant and these other guys.
And in fact, I was told by some people that were close to that, he's never going to play again.
Yeah. And well, that was for his Achilles.
Right.
Tendonitis. Yeah.
But then that gets turned around.
Yep.
And did you get involved in had you been involved in those? I can't ask specifically about him, but in those kinds of injuries, and you apply your A2M from Cytonics.
Right. So
tell us about that.
I had an opportunity. Well, I didn't have an opportunity. Someone else thought there was an opportunity to treat some other very, very famous athletes.
Yep.
I'm not going to get into that in this because you have to wrap it up. But I'll tell you the real story with the athletes. It's really sad because they just get taken advantage of by their agents, and most of these athletes are not educated.
Yeah.
They may not be. They have amazing talents, but maybe financial talent is not one of them.
Right.
And they get effing screwed over. It's the same exact thing in healthcare. They just get surrounded by their cronies. And even though there's something better that you might have,
they won't do it.
If I'm the doctor, there's no way I'm letting this guy out of my little world here because I don't want him to be with you. Then he's not going to be with me anymore.
Because you want to be the man.
So they think they're getting the best treatments. They're not. It's infuriating.
Because they're being herded. They're being corralled by people that are all about their own self-interest and their own reputation.
It's the same exact reason why Michael Jackson is dead and Whitney Houston is dead. And
nobody
dead.
that can help
people that care.
Though.
I'm like, man, if I was friends with any of those people, I would have smacked the shit out of them.
Right.
Dude, you're not doing that.
Right. So here you are.
And now
you are sitting on the OA cure.
Yep.
That everybody knows about, that's paying attention to your company, Cytonics.
Yep.
Everybody's watching it. Everybody knows about it. A lot of people have been talking about it. Years ago, I heard about A2M, I don't know how many years ago, but years ago.
So,
and
I want to say it's my team's discovery.
Yeah.
We figured it out.
Yeah.
And we were the first people to market it. I got to tell you the story real quick. I left Stanford.
Yeah.
The light bulb went off. I called up my team and I said, guys, new design challenge. I don't care how much it costs. I want you to make a system that super concentrates alpha-2 macroglobulin from a sample of a patient's blood. I don't care how much it costs. And let's do that because we're going to get approval through an FDA pathway for the 510K, FDA clearance, I should say. And so I can put it in myself and see if my kooky idea is good. We submitted the data to the FDA at the end of 2012, and I had to resign from Stanford because I knew that when it got cleared, I wouldn't be able to use it because of conflict as a physician. I can't use my own product. So I asked Dr. Maloney, and if I could, and of course, he said to me, I could come back at any time because I really enjoy the residents liked me and it was really fun. I'm looking forward to actually going back there and teaching. I loved it there. And so I left, and it took longer than I thought, but we got it approved I left in December 2012. And it actually, we had a failure once, and we ended up getting approved later. January 2014, so about 13 months.
Yeah.
January 13, it gets FDA cleared. I stick it in my knee joint right away.
And
the day it gets cleared. Now, I was told I needed knee replacements years ago.
This is from the motorcycle accident.
Yeah. So 2013, I inject myself. The next morning, I wake up and I call Lewis, my biochemist guy, who's amazing, the main guy that's on my team. And I said, Lewis, I'm going to go for a run. He goes, don't do that. He goes, we don't know what's going to. I said, dude, you know all about the placebo effect, where people think that it's just because I'm not going to lay here and pretend in my head that it feels better. I know I can't effing run. If I run 50, 80 yards, I got to stop and walk back because that's what was happening. I couldn't run for years. I said, I'm going to run. I'm going to run 1.5 miles. And I got out and I ran 1.5 miles. I came back and I had tears in my eyes and I had goosebumps. And I was like, dude, we've got it. This is it. And he came that week because he had a rotator cuff tear and I fixed him. And so this is February of 2014. We start giving it away to people. No charge. We injected, I forget the number, 30-something patients. Who's got a problem? We don't know if it's going to work, but we think it might. You got a knee problem, come in, we'll shoot you. Almost every one of those people invested in Cytonics. Most people don't have the money, but they invested. Right. And it's me, right? They invested. They always tell me, I don't know about it, but I'm invested in you. So we get to, and then one of the best things that ever happened to me in my life, besides meeting my wife, I'm one of these, a lot of people watch cat videos or they scroll through TikTok.
Yeah.
What I do, I was doing it this morning. And when I wake up at 3 o'clock in the morning because I got to pee, I start scrolling on PubMed. It's the NIH database. I'm looking for new articles on different disease processes. I'm one of these geeks. I know about cardiac. I just read all the new shit. As what I like to think about. And so alpha-2 macroglobulin, master inhibitor of osteoarthritis. Now, understand, we already had all the patents on alpha-2 macroglobulin, which is another story. We haven't gotten there yet. And it's Lee Wei, Brown University. Mary Goldring's on the article. She's a famous researcher for NYU, osteoarthritis researcher. I'm like, I read the article. I was jumping up and down. You guys ever see Back to the Future?
Yep.
The most exciting part of Back to the Future. Do you remember what happens when the car changes? 88 miles an hour. Do you remember this?
Yeah.
That's my email.
Yeah.
88 miles an hour. Gmail. I'll never forget that. He was ecstatic. So that's why I have that email.
Wow.
I was jumping up and down in the lab. Somebody else, because if I published on it, I was like, I want to publish on it, but people are going to go, of course you're saying that because you have patents. Brown University.
You didn't publish it. She did.
She and Lee Wei was the main author on it. Yeah. Lee Wei and Gary Ergo was part of the team because these things take a lot of, not just smart, but people with perseverance and grit with the work. They did this amazing study, and the conclusion was, we believe that supplemental injections into the knee of alpha-2 macroglobulin will stop arthritis. Their words, not mine. Couldn't be better. So I pick up the phone, my lab, I pick up the phone, and I call Brown University. Hello, can you please connect me to the Department of Orthopedic Surgery? Yes, thank you. Yes, Dr. Wee. Hi, Dr. Wee. I just read your article. Congratulations. That's amazing. You must be ecstatic. Yeah, very, very excited. Thick accent, Chinese guy. Oh, so excited. I said, Dr. Wee, my name is Guy Scuderi, and I'm so happy and proud that you did this amazing story. But I got to ask something. Are you sitting near a computer? He says, yeah. I said, what would you say if I told you that I had a product that's on the market that concentrates alpha-2 macroglobulin? He starts to laugh on the phone. The article just came out a couple of days ago. I said, punch in cytonics.com. He hangs the phone, he gets on a plane, he comes to my lab. Freaking out. He ran our studies for us with our recombinant protein for the small animals. He's the lead author on my paper that I did proving that because we built a synthetic version of A2M. He's on the article. So he's published extensively in this space, as have other authors. So what happens is that technology catches up to itself, and people, I don't know if you know the DNA story with Watson and Crick, but there was a Russian group that found that, some people say a little bit earlier, but Watson and Crick had filed first. And remember, no internet back then. So they happened to be the first people to file, but there's a lot of people, smart but also hardworking, that figure stuff out. And so it's a fascinating story with A2M. And then we started using it, and it got very popular. And patients and researchers and people started calling me up. And then, unfortunately, because people suck, especially business people, we have patents on the concentrating of alpha-2 macroglobulin. 7 other companies have built concentration systems for A2M. Now, how is that legal? It's not considered illegal because it's not like a violent crime, whatever they call those.
No, we call them IP bullies.
Yeah.
Yeah, that's what we call them.
And so they're concentrating. So I called by the way, we got the best patent attorneys in the biotech. When I was just who are the people that, it's like, who's the Michael Jordan or the Tiger Woods or the, Carl Yastrzemski, to me, because he's my favorite player, but the Mickey Mantle of biotech. It's Wilson Sonsini, so it's very expensive. That's the team that we use for our patent attorneys. I call them up, I go, are we going to sue these people? Or am I going to just start going around with a baseball bat and cracking all their cars and shit like this? What am I going to do here with these MFers, right? Because I really want to beat the shit out of it. Seriously, I really do.
Yeah.
Because it's fucked up.
Yeah, it's your life.
So it's just completely unethical. How does somebody do that? 7 companies making money, and they've so because we I couldn't spend my time anymore on building a business out of this autologous product. For me, it was just to prove to myself. So we immediately licensed it off, like sold it. It's called a license, and we get royalties from the company. And we're actually now with the third one. So I don't know what I was doing. So I sliced into somebody and said, I'll do it. And of course, they did a shitty job. And then the next people did a shitty job. And then this next company is not really doing that great of a job. Sorry, guys. Either.
Yeah.
They're not.
Right.
It's $1 million, $2 million business. But there's some big companies with the marketers, 7. It's about a $40 million a year industry now. And I get royalties on only $1 million. Not when I say Cytonics, the company.
Yeah.
And that money could have helped us. I could have been helping people with arthritis 5 years ago.
Right.
It would have already been out. But we're still about to start phase 2 trials. And so it was a nightmare. So I told the patent attorney, I said, what are we? And he said, wait a second, their patents right? Yes. Can we, what are we doing? Writing letters of cease and desist? We're going to sue them? Should I stick something on, was one of my buddies on him to visit the house? What am I supposed to do? And he's like, Guy, he goes, I have really good news for you. That's the best thing that could happen to you. And I was like, what? It's killing me. I said, we can't raise money. We can't get any VCs because no one invests in osteoarthritis. Nobody. That's a whole nother story about how people invest. It's all about, if you know a rich guy, and the rich guy has a couple of $1 billion in his pocket, what do you need? 10 million. You're my best buddy. You're my buddy from lacrosse or college, wherever it is. I got none of that. I got a bunch of Brazilian guys that are buddies with me, and we got no money. And so that's how these things get funded. It's all nepotism. And so the Wilson Sonsini guy says to me, dude, when a company comes to acquire you, when you decide to go public, they're growing the market for you. So instead of you having to try to convince the person, you don't have to convince anybody anymore that it works. Everybody else is doing it for you. He goes, that's the hardest job. I didn't think of it like that. And it's been painful to experience. But that's the way business works. I don't like it. That should be part of our money. They should at least be paying us royalties. But it's a complicated process for that to happen. And what I hear is what they do is they just close up shop, go out of business, and open up a new LLC the next day.
That's right. And
we still don't get any royalties. So it's just, for us, it's just a wasted exercise because the system, quite frankly, sucks. And it's against small players. That's why we only have Amazons and Microsofts in the world. We don't have any more. Everybody's seen You Got Mail. You see, you look like pretty young. You Got Mail? You got to watch that show because that's what it's about. That the little guy gets crushed. And that's amazing that I can still, I'm a little cockroach and I keep appearing again.
It's wild. And you don't fucking go away.
Yeah, no.
You won't quit.
It's amazing. That's one of the famous,
it's unreal.
One of the famous sayings of Elio Gracie in Gracie Jiu-Jitsu is, and you can look because he has a bunch of famous quotes, never, ever, ever, ever give up. That's one of his famous quotes that he said. It's a classic thing for martial arts.
Story, man.
So
I just want to sit all day. I want to mine this shit.
Yeah. No, you don't even know that.
I want to mine it.
Because I'm skipping to the end. We actually have humans that have been, we have a series in Australia, which is a whole other story, which, where do you hear? I'm telling you, it's going to be a Netflix documentary because this is going to be bigger than NVIDIA. And people laugh at me when I say that, but if I show you conservative numbers, everybody has arthritis. And here it gets better. Because of alpha-2 macroglobulin's mechanism, it protects tissues. It's a guardian. It's a bodyguard, not only for the musculoskeletal system. I have dermatologists. There's papers in cancer therapy that it actually is protective. You know, when people get, like my mom's had another bout of breast cancer, and they have to radiate the tissue,
yep,
and it kills normal cells.
Right.
There's another researcher, I'm so glad it's not me, that studied radiation therapy using A2M as a protectant.
No shit.
And it completely blocks
wow.
the normal tissue from being injured by this radiation. Published article.
The photon radiation that burns in and out.
Yep.
Yeah.
It's amazing. I have a dermatologist who wants to try it for rosacea. Many pathologies are associated with inflammatory conditions, and aging in and of itself is an inflammatory condition. alpha-2 macroglobulin is the protein that you make in your body that is anti-aging. It protects you from inflammation. The problem is, as we age, just like everything else, things get diminished. And in most people, because of the way that it moves around in different body compartments, because of its size, there's a specific mechanism by which that occurs. And in a lot of people, that mechanism is just okay. And so we have to figure out a way to improve that mechanism. That's another way to approach treating these diseases. But the approach that I took was trying to figure it out and find it. And now I have to deliver it to those disease spaces.
This degradation over time.
Exactly.
Right? Which is what people are trying to augment with things like peptides and things that improve mitochondrial function.
That's
what have you.
Exactly right.
Yeah. Even stuff like PEMI and VEMI, which are electromagnetic, they're looking to try to optimize cellular function that way.
Right. Pulse
so
electromagnetic.
Yeah. So
exactly right.
This amazing industry that falls under the banner of regenerative medicine, which is fascinating. I can't get enough of it.
Yep.
And you guys are frontline, and you've been frontline on it for more than 10 years.
With no interest and no investment, because
and
our banner is osteoarthritis, and everyone's like, that's like the third row.
To your point, I mean, as a patient, I know it's inevitable. Like, you're going to get it.
Yep.
You're going to have osteoarthritis in all your joints, and that's just the way it is. And yeah, you can take omega-3s, and you can do this, and you can do that, but it's a fact of life, and your body's cellular function and physiological function is going to degrade, and it's going to catch up, and you're going to get these things.
That's exactly right.
Yeah.
Yeah, and things like you mentioned, some of the new peptides, clomiphene, there's a bunch of different drugs out there.
I love it, man.
There's a lot of fascinating interest because we're all living longer and somewhat healthier lives for many of us, but there's a new term that's emerged called health span. I'm sure you've heard of it, right? Instead of lifespan.
Yeah.
No one wants to live to 90 if you're sitting in a wheelchair and you can't even bring your fork to your mouth, right? You want to be able to play pickleball.
But to the point, we got people in their 40s that are getting joint replacements, and that never happens.
Right.
And so, yeah, we're living longer, but our life quality is going down unless you can figure out how to hack it.
Exactly.
Which is why all this biohacking and all the regenerative medicine is such a huge passion for especially the American public. But for me personally, I just can't get enough of it. I love it. And I love what you're doing. Thank God for you doing it.
Thank you very much.
Yeah, so good to see you, man. What a pleasure.
It's great to see you too. Thanks for inviting me. Really appreciate it. All right.